We start tonight with yet another twist in the cyber attack saga that has targeted a Minnesota healthcare giant. It's been nearly 8 weeks since hackers first hit Change Healthcare. The subsidiary of United Health Group provides billing and care information to healthcare providers, pharmacies, and patients. Now, as that giant company continues to sort all of that out, Kent's here to explain why it's led to a brand new set of demands and threats.
Visit the website for Change Healthcare, and the cyber attack that crippled its payment systems is still front and center. But beyond being determined to make things right and stating we continue to make progress in mitigating the impact to consumers and care providers, the status of that progress remains murky a month and a half later.
This is truly a kind of worse than worst case scenario, something that I've never seen before in the ransomware ecosystem.
Make no mistake, Andy Greenberg has seen a lot as a senior writer for Wired, including the Bitcoin blockchain receipts of a $22 million payment last month to the group that claimed responsibility for the attack. While that likely added up to one of the largest ransoms ever paid out to hackers, Andy says it didn't exactly stop the threat.
That first group of hackers, known as Alpha, simply ran off with the money they were paid rather than sharing it with their partners who are still in possession of that stolen data.
Now, he reports that Change Healthcare faces another ransomware threat, with that second group threatening to release the stolen data to the highest bidder.
As of right now, do we know that any patient information has been shared?
Well, some patient information has actually been shared with me. When I asked Ransom Hub, this second group of hackers who are extorting Change Healthcare, to prove that this wasn't just an empty threat, they did send me a few samples of patient records, a contract that Change Healthcare had with another company. We don't know that they have the full 4 terabytes of data that they claim to have and are threatening to leak. But if they did, that would be obviously a terrible outcome for patients who would just have very sensitive information about themselves spilled onto the dark web.
I think the obvious question is here, why would it be advisable for a company to pay a second ransom when the first one didn't even really do what was promised?
Well, it's almost comical. Ransom Hub, the second group of hackers, did even say to me in response to this question, well, we're not like that other cyber criminal group. We can be trusted. We don't even want to hold the data. As soon as we're paid, we'll delete it. But yes, can you actually believe that when the first group of ransomware hackers actually said exactly the same thing? There truly is no honor among these thieves, it seems.
No honor among thieves. And keep in mind, sensitive patient info isn't the only thing hanging in the balance right now. There are still large numbers of physicians and hospital systems stuck in the lurch here that use Change Healthcare to sort out billing, payments, and even prior authorization for care. In a nationwide survey released by the American Medical Association last week, 80% of physicians said they lost revenue from unpaid claims, and about a third were unable to make payroll. Locally, the Minnesota Hospital Association says this is impacting some of the largest systems in the Twin Cities down to the smallest rural hospitals.
Some of our members are just dead in the water, just waiting to try and get bills sent out the door on behalf of their patients to be able to get paid and to keep revenue flowing.
Now, MHA says some providers have gotten help, Jana, with payments and cash flow, but I was told today that it could be Halloween before some patient bills will be sorted out and sent to those patients. If you're a patient waiting for prior authorization before getting a procedure or a costly test, right now we're hearing that they're hearing crickets from Change Healthcare.
Just an indescribably large problem for United Health and Change Healthcare, just down the street from here.
Yeah.
Thanks so much, Kent.